Hello friends, we are starting with a new chapter that is Preventive Medicine in Obstetrics, Pediatrics and Geriatrics, and today we are learning about Perinatal Mortality Rate. So before understanding what is Perinatal Mortality Rate, we need to know what is perinatal period. Perinatal period is the period extending from 28 weeks of gestation to less than 7 days of life after birth. So how do we calculate the perinatal mortality rate? So it is given by the formula late fetal and early neonatal death weighing over 1000 grams at birth divided by total live birth weighing over 1000 grams at birth, multiply by 100, where fetal death is defined as death prior to the complete expulsion or extraction from its mother of a product of human conception, irrespective of the duration of pregnancy and which is not an induced termination of pregnancy. The death is indicated by the fact that after such expulsion or extraction, the fetus doesn't breathe or show any other evidence of life such as beating of the heart, pulsation of umbilical cord, or definitive movement of voluntary muscles. If birth weight is not available, then gestation age of 28 weeks or body length crown to heel of at least 35 centimeters should be used. However, the preferred criteria is birth weight. So what is the importance of knowing perinatal mortality rate? The value of perinatal mortality rate is that it gives a good indication of the extent of pregnancy wastage as well as the quality and quantity of the healthcare available to mother and newborn. It reflects the result of maternity care more clearly than the neonatal death rate. A proportion of deaths which occur after birth are incorrectly registered as stillbirth, thereby inflating the stillbirth rate and lowering the neonatal death rate. The perinatal mortality rate, being a combination of stillbirth and early neonatal death, is not influenced by this error. Thereby, combining the two figures, the error in reporting of the death is minimized and uniformity in reporting is maintained. The factors which are responsible for stillbirth and early neonatal death are common, and therefore it makes sense to combine these two deaths under one heading. Also, many factors related to early neonatal death and late fetal death are preventable. So the causes of perinatal mortality can be divided into three headings: prenatal, intranatal and postnatal. The prenatal causes include maternal factors like age. So it could be extremes of age like teenage or elderly mothers. They are associated with increased complication and higher risk of mortality. Second is maternal diseases like hypertension, cardiovascular diseases, diabetes, anemia. Hypertension can result into uteroplacental insufficiency. Diabetes may lead to macrosomia. Severe anemia can result into heart failure. The third is pelvic diseases like uterine fibroids, endometriosis, ovarian tumor. Then there are other causes also like anatomical, so any uterine and cervical defect. Blood incompatibilities like Rh incompatibility can result into hemolytic disease of newborn, toxemia of pregnancy, malnutrition, anemia, antepartum hemorrhage. Conditions like placenta previa or abruptio placentae can cause shock, preterm labor and malpresentation of the fetus. Then fetal congenital defect can also result into intranatal causes include birth trauma. So birth trauma could be because of injuries resulting from the use of forceps or vacuum or due to malpresentation. Birth asphyxia, prolonged or obstructed labor can also result into asphyxia, intracranial hemorrhage and infections. Then there are obstetric complications like cord prolapse, shoulder dystocia, uterine rupture, which may cause acute fetal distress and death. Postnatal causes includes preterm or low birth weight babies. These are more susceptible to infections, hypothermia and death. Second is respiratory distress syndrome. Third is congenital anomalies, and the next respiratory and intestinal infections. So how can we prevent this? There are direct measures and indirect measures. Direct measures, these are the measures if taken can modify the problem of perinatal mortality pretty quickly. These measures act both at primary and secondary prevention level. So the direct measure includes: first is safe and clean delivery with skilled birth attendant, which will help to minimize infections and complication. Second is essential care of newborn at birth, newborn resuscitation, infection control measures, exclusive breastfeeding, early diagnosis and management of complication, special care of preterm and premature infant, ORS and antibiotics for diarrhea and acute respiratory infections, respectively. The next is indirect measures. These factors, though intangible, they have a role of immense importance and operate at the level of family, community, healthcare, and society at large. These factors are mostly acting at promotion and primary prevention level. Now, the indirect measures include: first is prenatal nutrition of mother by ICDS to prevent low birth weight babies. Second is education of the mother on pregnancy and child care. So, health education promoting the adoption of family planning methods to ensure spacing and limiting the family size, use of ORS, importance of immunization, breastfeeding, and complementary feeding. Other measures include good antenatal care, growth monitoring of the child, prevention of malnutrition, weaning practices, breastfeeding, vitamin A prophylaxis, gender sensitization, improving the environmental sanitation, provision of safe water supply, building toilets, sewage disposal system, measures taken for overall socio-economic development, improving female literacy, and provision of primary health care. So with this, we have come to an end of this lecture. If you found this video helpful, like it, share it, and subscribe for more.